Good afternoon to all of you that have decided to join this Lunch and Learn today. Um, I'm Dr. Christine Lewis-Pugh, and the title of DEI doesn't have to be a HAG simply means that DEI doesn't have to be ugly if you stop and spend a moment with honesty, acceptance, and grace. So a little bit about me. I'm an assistant professor here in the Department of Counseling and Human Services at ETSU. My experience lends itself to the K through 12 sector. I was a former professional school counselor in the state of Mississippi. I spent the last decade advocating for students in the middle school grades of 6 through 8. I also am a licensed professional counselor in the state of Mississippi, where I have experience working in a psychiatric hospital with adolescents through adult and geriatrics. I enjoy working with children and adolescents. That's probably my favorite population. I am nationally certified as a counselor and a nationally certified school counselor with an interest in the effectiveness and self-efficacy of school counselors working with students with disabilities and special populations, resiliency and restorative practices in school, advocacy and collaboration with school administrators and outside agencies. So that's the work that's truly, truly important to me. For today, we're going to go through diversity, equity, and inclusion defined. Talk a little bit about DEI in education and in counseling. And then we're going to discuss a concept that I always called my HAG, that I always introduce to my students, as well as people that I meet. And then what can you do? And you can feel free to chime in if you have a question. I may pose some things to you. I recognize that some of you may be eating, so that is totally fine. But if there's somewhere in this presentation that you have a question or you want to stop me and ask, please do so. Feel free. So let's get started. So DEI is a term that is describe the policies and programs that promote the representation and participation of the different groups of individuals that include people of different ages, races, ethnicities, and abilities and disabilities, genders, religions, cultures, and sexual orientations. And we don't really escape DEI wherever we go. But I recognize and I find even in teaching with students that you can be fearful depending on the situation that you're put in. I'm from the western part of Tennessee, which to me, in my opinion, is more diverse than East Tennessee. So when I'm speaking with my students, I always let them know I don't necessarily speak for the African-American race, but I speak from my experiences. And it's very important to preface with that because they don't get a lot of exposure to the African-American culture. So I want them to feel comfortable in asking questions to me about it, but recognizing that they may have to explore some of the answers through different lenses and different experiences because I am only one person. And so it can look different and feel different when you are in an area or you're in a workplace that doesn't really expose you to much diversity. But it's very important that you embrace the diversity that you do tend to get exposed to. So when we break down diversity is simply the ways in which people are different. And different is a word that I want to hone in on is because a lot of times you hear the saying that it's our differences, but we're all the same. We can't be same and be different. And so once we recognize that we do have differences, it involves the way in which like our race, our ethnicity, sexual orientation, our socioeconomic status, our gender identity, religion, language, age, marital status, veteran status, mental ability, physical ability, or living with a disability. So once we acknowledge our differences, it's easier sometimes to go into conversations and have those conversations surrounding what our differences entail and also our experiences. When we talk about our equity, it's the assurance that opportunities are available to all of us. Fairness and access. Who has access to what? What are the barriers? We're trying to remove the barriers that prevent some groups from fully participating. Equity, it promotes justice, fairness, and impartiality within the processes, procedures, and distribution of resources by systems or institutions. So when we tackle equity, we have to understand the root causes of the outcome disparities in societies, because not everything is fair. And a lot of times we use the term, sometimes I always laugh because I have parents when I worked with parents, and they would say favor ain't fair, but somebody has to get it. At the same time, when we're talking about equity, being equitable and engaging in equitable practices, especially when we talk about in education and in counseling, we have to make sure that our that opportunities are presented to everyone, no matter what their diverse background or differences that they encompass. And so we try to teach this practice also at the K through 12 level, especially with students with disabilities, when students look around the room and wonder why one person may be receiving more assistance than another. And so it's very important that we embrace that equity piece of DEI. And the last one is inclusion. And so that's the culture that is built so that everyone feels welcome. And we always talk about this thing of culture and climate in the workplace, culture and climate in the school. We have to have that culture and that climate have to pair together. They're one and the same. So if we build a culture that makes everyone feel welcome or inviting to every person or group to contribute and to participate, I can honestly say I do have personal experiences where you walk in a room and you're not necessarily excluded, you're there, but you're not necessarily invited to participate or contribute to the conversation. And so what you want to make sure you practice in this is that everybody is included in some way, form, or fashion. When we talk about our work environment, that is inclusive of supportive, being respectful, collaborative, and it aims to get all of us to participate and contribute in some way, form, or fashion. We remove those barriers of discrimination and intolerance. So a lot of times the barriers that are there sometimes weren't necessarily created by the people that are in the room, but created by the systems in which we are practicing. And so it's generational. So sometimes we have to break down our systems where we work and where we have discussions in our committees to see what practices have we implemented that may make someone feel like they are not a part of the conversation. And so when we break down DEI, it's not as bad as what we feel, but sometimes the ugly gets into the policies and the practices and the politics that surround DEI. In counseling, we follow a set of guidelines of multicultural and social justice competencies, and we speak directly to the privileged and marginalized counselors. And so in that, when we're speaking to them, we talk about counselors' self-awareness, understanding the client's worldview, the counseling relationship, and counseling advocacy interventions. Looking at that self-awareness piece, it's the exploration of one's attitudes and beliefs. School counselors do exactly the same thing. I challenge you and charge you that in your professional workplace or whatever it is that you do, what is your self-awareness about the development of knowledge, your skills and actions that as it relates to your own self-awareness of the world? How do you view the world? How do you view your experiences? Because that's going to entail how you see others and how inviting you are to the concept of DEI. Our client's worldview, or in this case, another's worldview. We have to look at what is their awareness, what is their knowledge, skill, or action in understanding that client. How do we understand them? How do we understand the people that we work with? What are their experiences and how they are the same, may look the same as us, but how are they different? When I'm teaching my students, I always let them know, and I always tend to point out if there's another student of color in the room, that where we may look the same, we have different views, and I have to be willing to understand one's views. And just because I have a set of encompassed values, beliefs, and attitudes towards things, that does not mean that we share those values, those beliefs, and that understanding. And when it comes to that counseling relationship or relationship with others, the awareness of what my attitudes and my beliefs are, and my knowledge and skills and actions toward a certain event or my worldview, and yours, how they differ, that creates the relationships of being together, and how those experiences of power, privilege, oppression influence the relationship, okay? So what level of oppression have I experienced? What level of power do I have? What level of privilege do I have? in certain situations. I can give you an example I gave to my students. We were discussing a topic that we'll talk about a little bit later, and I was letting them know that my first experience as a licensed professional counselor in the state of Mississippi, I had the opportunity, I was working with a college student, and this particular college student was a white male, and walked into the room, and it was fine. And we began to have our discussion, and, I gave confidentiality, and we worked through, and we spent about 4 weeks together. And then on that 5th week, when he came in, he said, could he talk to me? And once he talked to me, he basically said, although I came into this counseling relationship feeling like you would never be able to help me, you have helped me more than any other counselor that I've had. And I just wanted to let you know that even though I saw you and thought that you couldn't, I see now that you can. And so to me, the power that he had was more than me, because he was from a higher socioeconomic status and from a place of privilege. He also was able to look at and that barrier there of, I don't know how an African-American woman counselor is going to help me. He was able to see through that lens. Okay, even though we're different, there are things that a counselor that I may have more power over can help me with. And so our relationships, even though our attitudes and beliefs about things didn't always line up, through the counseling relationship, we were able to address some of those things in those 5 weeks for him to be able to say that to me at the end of our counseling session. And that is powerful, where I didn't even recognize that. I saw the privilege, I saw the power through socioeconomic status that this client entailed, but bringing it back to a level of just humanity and just what we're going through and shared lived experiences that are similar, but not necessarily the same. That's the power of the counseling relationship. So even though our statuses were different, we still could experience and level those things out, even though that influenced our relationship together. And so that's important when we're talking about a work relationship with someone. And so you have to explore your experiences with power, your experiences with oppression, your experiences with privilege, and acknowledge those things. The toughest thing I will say is to be in a position where you don't feel like you have power, and someone who does says it's by chance that they have power. No, you have power because of who you are and because of the DEI statuses that you hold. And when we don't acknowledge that, that's tough for me to even see, because I do recognize when I walk in a room a lot of times that the power may not be lended to me personally. And so that's where we go into our counseling and our advocacy interventions. So we intervene on behalf of clients with those which is my personal dealings, and then the those that are around me and how they support me through this institutional, community, public policy, and the international and global levels of knowledge, skills, actions. We go through all of those things in our awareness of what they can do and how can we intervene on behalf of those with multicultural backgrounds, especially those historically excluded populations. So it's very important that we understand our competencies versus our privileged and marginalized counselors, because in this field of counseling, we don't get a choice a lot of times at who we counsel. And in not having a choice, my experiences are true, and my experiences do contribute to the relationship that I will build with every client that I come in contact with. And so I also utilize that on the outside when I'm in a work relationship, as well as in just a professional aspect of just understanding our privilege and my privilege as an African-American woman and the lack of privilege that I may have, but also my marginalized identity as well. So when we get to this DEI and education is one of those places that has a long history of disproportionate teaching practices, that I will call it. And so if you ever read Shame of a Nation, or have read just the history of education, we talk about DEI in education, but we've been going back to achievement and opportunity gaps, which some people will always use those interchangeably, and some will just use them separate. And one will the achievement gap and the opportunity gap. But when you look at it, it goes back to the early practices of who taught students of color. A lot of times they weren't certified. And so we're starting out when we talk about, let's talk about the achievement, which is the disparity in academic performance between a group of students. And so we go back to days of segregation when we were segregated. Who were the teachers in the room and what materials did students have access to? A lot of times the access to the material wasn't indicative of the times because it was old resources and books from the privileged population. And so when we look at it from that aspect, a lot of my ancestors who feel like they were oppressed or they didn't have the resources that I have access to now, I didn't quite understand that growing up, but I know now they didn't have those resources just because of how they were taught. And it's closer than what we thought. My mom was born in 1963, and basically she went to her first, I think 3 years, she said, in a segregated school. And so we're not far removed from teaching practices that disproportionately affect our Black and brown populations, where teachers who did not come from an education background were allowed to go and teach in schools and be certified as long as they taught to a colored population. And so hearing that and reading that, that was shocking to me because that told me that a lot of teachers, some of them took time and really wanted to get to know the areas and the communities and where they live, but some of them were there just to get a check and not exploring the students that they would one day teach. I have the opportunity to be from the Memphis area, and there's a lot of urban schooling and population which looks very different from impoverished communities here in East Tennessee. So when we talk about the urban community, there are teachers that go to communities that they have no idea, they've not done their community mapping of understanding the dynamic in which these students come from. You can sub all across Memphis and see the variations of what these communities have done. I have a mentor now that is currently working in a school that school is most likely the cornerstone of that community. Without the school, there's no community. And so there are a lot of places like that, I believe, in Memphis that fulfill that cornerstone of the community. Where you remove the school, you're removing the community. But the fight to keep those schools in those communities are very vital and very important. And so even coming here to East Tennessee, I heard the story of Southside and how the community of Southside fought to keep Southside within the community as an elementary school as they began to connect and begin to merge schools, like keep Southside, because Southside was the pillar of that community. And so it's important that we look at that. But with the passage of the No Child Left Behind Act of 2001, they begin to talk about closing this achievement gap in performance. And so it was a federal education accountability model, and the schools and the districts were required to disaggregate the student test scores and other performance data by the characteristics of race, gender, socioeconomic status, and language. And even though we know No Child Left Behind was in 2001, and there's other educational reforms that have come since, this is one of the tenets of deaggregating that testing data that continues to be reauthorized. But it also, with this tenet, it created an awareness of racial disparities and the rising concern about other kinds of achievement gaps. But what also may be considered passing in one state was failing in another. And so that was because states got the choice to choose what constitutes a passing score. And so we see that saw that a lot of times. I used to work in the northern part of Mississippi, which was right on the state line of Tennessee. And so a lot of times what was sad was the grade transfer from Tennessee to Mississippi looked very different. And so what was passing in one state wasn't passing in another, or what constituted gifted in one state or honors course did not constitute that in the state of Mississippi. And so we still see that. And so even in Mississippi, we do our gifted student status on IQ, whereas Memphis does it on academic ability. And so when parents come and sign their kids up to come into the schools and we see gifted or we see CLUE on the schedule, we either had to try to get them tested or we could not put them in the gifted course because of the identifiable testing standards that went along with Mississippi. Does that mean that a student can't achieve? No. But that's how we targeted it. And so the attention to more targeted interventions for different groups of students, but it has not closed most of the gaps in over a decade since the law has passed. So we've been giving focus to this testing, focus to testing, standardized testing, high stakes testing, whatever we want to call it, but nothing has really changed, okay? And so even though it's often called the achievement gap, we've started to look more at the opportunity gap. Because the opportunity gap is the uncontrollable life factors that contribute to lower rates of success in the educational achievement, career prospects, other life aspirations. So it's almost like when we look at achievement gap, we're so focused on the academic performance of the groups of students. But when we look at the opportunity gaps, what areas do these students lack or don't have an opportunity, or there's a barrier that prevents them from closing the achievement gap? And so I always think about it as we almost can't look at one without looking at the other. The reality is that we are not all born the same. And sadly, we won't have the opportunities as some of our counterparts will, let alone some of the resources to access it. Now coming to East Tennessee and working with smaller school districts, I'm noticing that the resources that are available, that a lot of times parents don't take the opportunity to get in larger cities, smaller towns and communities are vying for those resources. So it has nothing to do with a person's potential or ability, but everything to do with the opportunities available. And I also, in my belief in education, it leads to that restorative practice lens of repair the harm and repair positive relationships. And so if you know about restorative practice, we're talking about transforming the positive idea in school systems and looking at restoring students. So when we look at opportunities and we begin to look at it through those chances, how can we close the opportunity and the resources that students have that may in turn close those achievement gaps that they experience? So who does this all point to a lot of times in the schools? As a former school counselor, we have an ethical responsibility to expand that multicultural and social justice advocacy and awareness for all of our students. We work toward cultural competence and cultural humility, which we will talk about a little bit later. But what we do is we can address the impact of poverty and class, social class that they have on student achievement, identifying the impact of family culture upon student performance, and then just ensuring student rights are respected and all students' needs are met. We consult, we collaborate with stakeholders to create a school climate that welcomes and appreciates the strengths and gifts of culturally diverse students. And that's important to have in your school, even if your school doesn't have much diversity. How can your students be exposed to diverse issues or diverse communities through the process of teaching that will allow them to develop their own self-awareness about these communities? The saddest thing, as I say, is experiencing culture your first time when you have to go in the workplace or when you have to embark in college. We should be teaching these practices from a very young age and enhancing our own cultural competence, cultural awareness, and knowledge of the skills of everybody that is around us, so that we can create a culturally sustaining school counseling programs, which includes advisories that help us to understand more about the diverse perspectives and the representations of our own schools. DEI in higher education. So a lot of higher education models are moving from this deficit-based model of fix the victim. And what we mean by that is just basically placing bodies of diverse individuals into positions to say that they check the box, to systemic change in the culture and the policies of universities. And those that have, this has provided the encouragement and hope to marginalized communities that there is hope for us at this level of our educations. But the considerations in this practice of changing the system is to understand the biases that those of marginalized and historically excluded populations experience in the biases of their teaching evaluations. We don't look at that. So when you're looking at a 5 or a 4, what does that really mean for a person of color? Funding and publication success. How successful are those of color in their funding or in their publication success? What is it about it? And transition to the professoriate. Honestly, my transition has not been terrible. I can tell you my experience with transitioning to the professoriate. But I also say there's a lot of support, because there's a lot of things that go into being a person of color at the level of higher education. A lot of times you'll see the service requirement. It's elevated in marginalized populations, not because that's put onto them, but I always say we have this thought process of being twice as good to get half as far. A lot of times that's taught to us, that we have to put on the best dress, we have to put on the clothes, we have to look a certain way to be respected or accepted in the positions that we're in. And that's not just only at higher education. I a lot of times feel like that in K-12, going through my doctoral program. So that's my experience, was having to be twice as good and still feeling like that at times, to get half as far. And so, do people actually see me? It's always the question that a lot of times, a lot of us still have. What we do know is that there's still this disproportion of historically excluded populations that represent the various aspects of higher education. So you can look at certain departments and they may not have a diverse representation. But the question is how can you change that? How can you start appealing to diverse populations to come and participate or be within your department or in your school? And so we talk about in counseling, these are just some areas, again, that I spoke about that we make sure we focus in on and make sure we teach our students that they may be uncomfortable with these areas. And it's okay. You're not going to be knowledgeable about everything, but you need to have some cultural competence in these areas. Our ACA Code of Ethics, it emphasizes that counselors are ethically obligated to work at an understanding of the diverse cultural backgrounds of the clients that they serve. We can no longer just decide that we want to refer a client based on one of their cultural identities that we don't have any experience to work with. So it's very important that students recognize this and know this and become at least culturally competent in what they're doing, but also we want them to begin to have some cultural humility as well. And so when we talk about this cultural competence versus the whole cultural humility, the key thing to know here is what I know, cultural competence, has an endpoint, versus what I am committed to understanding, the lifelong process. Cultural competence is an essential skill for clinicians, counselors, and trainees to develop the cultural awareness of self and others that aid in the differing treatments from cultural groups other than one's own. And so along with the development of that was cultural humility, which is the self-reflective openness to recognizing the imbalance of power as one begins multicultural work. And cultural humility originally developed from Tervalon and Murray Garcia in '98, which was developed on the health side to address the health disparities and institutional equities in medicine. And so what they were finding is that there was a mismatch in client and provider, where the lack of knowledge of one's own health beliefs and life experience and the provider's unintentional and intentional process of racism, classism, and homophobia and sexism. For instance, if a doctor was to prescribe a particular medication and a person of color said, well, let me go home and pray about it, the doctor not understanding that religion is a distinct part of this process in helping them understand that, or hurting their feelings in the process. Now, I won't share my personal experience with the medical sector, but I will tell you that that is very true when it comes to diverse individuals, the treatment. And so, there's a lack of trust that started with the mental health that we'll talk about in a second, that started in the medical profession. So the commitment in cultural humility is with clients, the community, colleagues, and the self. The process is to check the power imbalance that exists. So what you want to have is your cultural competence and understanding that endpoint. That's all the learning that you do. But also the cultural humility, the lifelong process of understanding people where they are and what it takes for them to get what it is that you need from them. As a counselor, not having cultural humility and competence paired, I don't think I could be as effective as I am. And so I have to understand that my one situation and my one experience doesn't dictate those that I work with. So what we do in counseling, we do this thing called broaching. And so that's the counselor's effort to discuss those racial and racial, ethnic, and cultural issues that are relevant to the client's pressing concerns. We broach because of the fact that in counseling, there's a distrust of the mental health professionals due to historical dehumanization, oppression, and violence. And it all began with the medical profession. We talk about the Tuskegee trials, the birth control trials. We can talk about all these various methods that African Americans are quicker to be diagnosed as schizophrenic or bipolar than any other race. Why is that? So people of color whose lives have been marginalized, they experience a way of being devalued. And what we call this sometimes, Mental Health America calls that, says that racism is a mental health issue because racism causes trauma. And we know from the experience of trauma, it paints a direct line to mental illness, which has to be taken seriously. So everyday people of color experience far more subtle traumas. And what we talk about in those traumas is people who avoid them in their neighborhoods or out of ignorance or fear, getting denied loans, or people won't lend them money, or they do so at higher interest rates, mass incarceration, school curricula that ignores or minimizes their contributions to our shared history, and racial profiling. So one of the biggest things that I always tell my students in my in class is that broaching is important, even when there are minimal differences. We broach with our clients on a regular basis so we can get used to addressing differences that we may not see. Everything about DEI is always not seen, but it's what you culturally encompass, okay? So getting to what can help you with this, and I call it the H.A.G, because H.A.G, you just say H.A.G is ugly. So it's a noun, an ugly, slatternly, or evil-looking woman. But the H.A.G doesn't have to be ugly. And the way we can do this is honesty, an adjective, free of deceit and untruthfulness, being sincere. The ability to be transparent about your thoughts, feelings, and actions toward DEI. What do you feel about it? Spending time with honesty. We want to spend time with, we don't want a moment with, because when we spend a moment with something, it's quickly gone. But when you spend time with honesty, you can look at Audre Lorde's comment and say, talk about it and discuss it. It is not our differences that divide us. It is our inability to recognize, accept, and celebrate those differences. If you sit with just that statement, what does that say to you? What are you self-aware? What does it lend to? When we talk about the achievement gaps, Carter and Wellner talk about thinking in terms of the achievement gaps emphasizes the symptoms. Thinking about unequal opportunity highlights the causes. Is that cause and effect? So when we spend time and have a moment, spend time with honesty, we have to be honest with ourselves of what we feel about those statements, what we feel about what we're going through. Acceptance, a noun, the action or process of being received as adequate or suitable, typically to be admitted into the group. The ability to be receptive to a new way of thinking, acting, and doing that is not one's norm. How are you receiving those that are different from you within your groups? It's uncomfortable, but we also know that change is hard because it's uncomfortable. And so when you spend a moment with acceptance, the responsibility belongs to us all. We want a workplace or an organization free of institutional barriers, equal opportunities, where culture and climate that is inclusive and equitable. Like I said, I don't think a lot of times when we're in our workplaces, anyone is intentional in making something not inclusive or making it not equitable. But it's the systems in which we work or have worked that we don't take a step back and spend time with our honesty in the moment or our acceptance of it. And sometimes some of us have been brought the situation of maybe we weren't as accepting, but we couldn't see the acceptance because we didn't spend time with it. What was my responsibility to my coworker? What was my responsibility to my student? What was my responsibility to enhance the culture and climate or the systemic change that my university or my school district is trying to encompass so that DEI doesn't have to be so ugly? And then giving yourself some grace. So we know that grace is a period of officially allowed for payment or some, where basically they give you a grace period, but it's also the ability to take time to understand rather than be understood. DEI, a lot of times you hear people want to be understood. rather than trying to understand the other side. What does it feel like for the other person? As a person of color, there are other people of color that I have to stop and try to understand them rather than have them understand me, because their experiences are not like mine. And so it's important to have that moment of grace. And when we spend time with grace, we recognize that there are known knowns. These are things we know that we know. There are known unknowns. That is to say, there are things that we know we don't know, but there are also unknown unknowns. There are things we don't know. And that's Donald Rumsfeld. But the problem is the yet. And that's the growth mindset that we have to encompass. We can learn. And we have to continue to try to embrace and learn what we can about everyone that may or may not be different from us. So I beg the question, what can you do to lessen the ugly in DEI? Spend time with the H.A.G when things are getting ugly or uncomfortable. Seek out opportunities to educate and get training about DEI. It's okay to say what you don't know. Learn about those microaggressions, the unintentional acts of discrimination, and the microaffirmation. Those are the inclusionary actions that encompass the caring and listening that your coworker of a diverse background may need, telling them they did an awesome job, letting them know, I liked what you said. That goes a long way in assisting someone that may be in a new position or just may need those affirmations to know so they don't develop what we call imposter syndrome, feeling of inadequacy despite success. Okay. And then tokenism, choosing to be the one to be the representative. Try to avoid that where you choose the one and using terms like they're not like you. Someone isn't supposed to be like you. That's one of the biggest things I hear all the time. Oh, I like such and such, but they're not you. And so that is a tokenism system. And I don't think people recognize it. I think it's unintentional, but it has happened so many times where I've been compared to someone who may look like me and stated that, oh, well, they're not you. They're not supposed to be me. Also, you can ensure diversity is represented in the committees, the panels, and in leadership that you have an opportunity to control or help to vote in or have a say in who should have these positions. And then invite persons from historically excluded groups to speak. I also say that on the other side, if you're working in a community where there are more people of color, then you want to invite someone from the outside so that they get the same exposure. So sometimes this DEI works both ways. We want to be able to be exposed to as much as possible that we can. And so with that, I always will say DEI doesn't have to be ugly. It doesn't have to be a H.A.G, as long as you spend time with honesty, acceptance, and grace. Are there any questions or any comments? Okay.
Dr. Pugh.
Yes.
Hi, I am Dr. Oliver with APSU, and I have my students tuning in with you. And we appreciated your presentation, but we have a question regarding how do you advocate for DEI in working with special education with other like teachers and staff members and counselors and getting them to collaborate together to have this mindset?
So one of the biggest things in DEI, I won't tell you that it's easy to do the collaboration, but as a former school counselor, I had to understand special education from the lens of the special educator. And so it's very important that you collaborate and don't do this work on your own, but helping to break down those barriers of what do people understand, what has happened in that special education population, because you do have teachers that take a stance. As a school counselor, let me tell you like this, there were teachers that didn't want certain students in the classroom, especially if they had a disability or they wanted them off their roster because they couldn't. Is trying to understand, where did that particular stance develop? If you can get to the root of where that developed, now you don't want to impact your student. So a schedule change may be deemed necessary, but it's important not to forget the DEI that teacher or educator lacked. So it is time to start advocating and start putting those things in writing and trying to have those discussions. And that the first discussion, it may be with you, is what are their fears about working with a student in that population? Where does this information stem from? Where does that fear or anxiety or the fact that I can't work with this student, where does it come from? And once you kind of address the where does it come from, you can lend the lens, your professional lens of how you can execute the training or the interventions to assist them, because guess what? They're not going to be able to avoid it forever. Does that answer your question?
Thank you for that.
Any other questions? Well, as I always say, as a former school counselor, I will always speak for my profession, and I will always try to make an impact daily. I am here to consult and support anybody and be a provider of information. Should you all need anything from me, here's my contact information. So I thank you for listening and the opportunity to speak today.
Thank you, Dr. Pugh. Everyone, please take note of the chat and complete the evaluation. This allows us to plan for future lunch and learn events. Thank you so much for being here with us today. And we look forward to seeing you at the next one next month. Have a wonderful day. Bye.